Hi, Sarah. Well, thanks for coming here today. I know you've been having some trouble with your breathing and feeling shortness of breath when you exercise, shortness of breath when you talk. And we're going to start off our session by talking about why that's occurring and how that relates to the anatomy and the physiology of the mechanism inside our neck called the larynx. So to start, we're going to look at this picture. This is a side view of a head and neck. And I'm going to point out some structures and name them, and then we'll talk about how the physician evaluated them. So we have the nasal cavity here, and your nose is here, and so that's when you breathe in. The air gets really humidified, it gets filtered, the little hairs trap dirt and debris. So it's really the healthiest way to breathe is in through our nose because that helps us to filter and humidify the air. Right here is like the roof of the mouth. We call that the hard palate. You can feel that with your tongue. At the back, that's called the soft palate, and it's just softer and fleshy and muscular. And we use that to help us close off the space if we're going to make like an oral sound like ah versus a nasal sound like mm. So that's what that is for. And then we have the tongue right here. And the oral cavity is just the space in the mouth, lips, and teeth. Okay, so now that we've got a handle on the structures, let's talk about what the doctor saw when he scoped you. So if you remember, he had that flexible scope, put it in through your nose and went back to the back of your throat right here. And he looked down and shined a light so that he could see into your larynx or your voice box. So when he shone that light, what he could see was, first of all, this cartilage. It's a flexible cartilage called the epiglottis. It flips over and it covers your windpipe when you swallow to protect you from choking. The vocal cords, or you might hear us refer to them as vocal folds, either is totally fine, sits at the top of the windpipe or the airway, also called the trachea, and it acts like a doorway. So when the door is open, air can flow easily. When the door is closed, you can't breathe. And we're going to talk a little bit more about how that relates to your specific shortness of breath. So the windpipe is below the vocal cords. On the other side is the esophagus. That's the food pipe. So if you ever feel like things go down the wrong pipe occasionally when you swallow, that's considered normal. We all get a little discoordinated sometimes and things go down in the wrong way, but we usually cough it back out. It's only a concern if it's happening daily or becomes impactful for your health. So to better understand the problem that you're having with breathing, we're going to look closer at those vocal cords. Okay, so this is like a bird's eye view or a view from above of what the vocal cords look like. And I'll point out that they're shaped like a V. They're connected at the front of your body and they're open at the back. So right now you're sitting here quietly and not speaking. This is what they should look like. They're open for breathing and the airway is right below. So when they are open, it's unobstructed, it's easy flow of air in and out. When we go to speak or sing or make any sort of sound, they come together like that and they close off the airway. The air comes up and sets them into vibration, and that's how we make sound. Sometimes what happens is that these signal or these sensory nerves within the larynx around the vocal cords can kind of get mixed signals, and they will perceive that there's a threat or something in the environment that you should be closing your airway for. Sometimes it's something very innocuous, just like a smell. Sometimes it's a change in a temperature. Sometimes what happens is if you're exerting yourself or exercising, that heavy breathing that you're doing when you're working really hard can trigger it. And so what happens is instead of having wide open vocal cords to allow for easy breathing, they slam shut. And that's what the physician saw when he scoped you, is that the vocal cords, instead of being open during resting breathing, is that they would close. And what that feels like to you is tightness in your throat. It feels like you can't breathe in. It feels like there's a lump in your throat, or like, kind of a strangled feeling. And I know that you had told me that that was really scary, and that makes sense because not being able to breathe deeply is a very scary thing. But thankfully, you saw a pulmonologist. They verified that your lungs are fine. Everything's healthy in your lower respiratory tract. It's just these vocal cords that are getting the mixed signals and are tightening and closing off. episodically, and that's causing your breathing difficulty. The good news is that we can do breathing exercises and some respiratory retraining, which will help you go from this to this. So that way you are not experiencing those really scary episodes. Does that make sense so far? Great. The last thing I'll show you are just some pictures of the whole system put together. And this is really important because we're going to work a lot on breathing and breathing techniques so that this space opens and relaxes and stops causing a difficulty with breathing. So the first structure I'm going to point out is at the bottom of the page. This is a dome-shaped muscle that's right about here, and it's called the diaphragm. And the diaphragm, when it contracts, it moves down and forward, and that pulls on your lungs, and that allows more space in your lungs, and that causes air to rush in. So when you breathe in, it starts with the diaphragm. Now in your case, that's all working fine, but it's encountering an obstruction right there at the level of the vocal cords. And so that's why you can't get a deep breath in, and it feels stuck right here. It's because it kind of actually is. So we'll work on trying to kind of reconnect those two actions so that when you breathe in deeply, you get that airflow all the way through and all the way down. Then when you exhale, the airflow comes back up. If your vocal cords are closed, they'll make a sound when you exhale because you set them into vibration. But if the vocal cords are open, it'll just be quiet, easy breathing. And we'll talk about, as we do our breathing exercises, how to keep those vocal cords open and how to keep them from tightening back up again. How's that sound?
Good.